What I really wanted to do was take JAC's richness and extensive user community and enable us to actually come up with a consensus of design. The initial exercise that we did was in the UK. This was based on the prototype that we had come up with, and we took that around to 10 different sites over 10 days, starting in Aberdeen at the top of Scotland and working all our way down to Cornwall and the Isle of Wight in the south of England. Each session lasted about 30 minutes. We'd bring the user in, we'd get them to fill in a questionnaire that helps us understand their background, understands various dimensions about the user, the discipline that they may be working in, paediatrics, acute care, mental health. And that then enables us to make cuts of the data to understand how different users are responding to things. But it also allows us to spot trends between all users. (271), the largest contingent was pharmacists, very closely followed by nurses, then doctors. We also saw some allied healthcare professionals, pharmacy staff, and another group which we call others, which tended to be people from IT or managers. We use the data and the comments that were made by the user to then come up with an action list of things that would need to be changed in the design. The quick chart function was another thing that came out of workflow, understanding that nurses needed something to be much more rapid. Our initial concept meant that it was probably going to take around 30 seconds to record an administration, given all of the steps that they had to go to. And we realised very quickly, speaking to the nurses, seeing what they did, that needed to be much quicker, and we brought it down to several seconds. The more eyes, the more clinical eyes we get on the product, the better, the more likely we are to drive out those clinical safety issues. And that's why we take such a large amount of time and resource within the project to get out there, show people the project, actively engage them in a managed exercise and identify those safety issues. We've taken the opportunity to improve the product. As we open up the product, as we rebuild the product from the ground up, there is opportunity to actually embed new features, new functionality, make small improvements that we know the user community have previously been asking for, and we've tried to maximize that opportunity. So incrementally, the product is always improving, it's always getting better.